Hi, I am Dr. Mishra. I am a MBBS and MD in dermatology. I have been practicing dermatology in Delhi for the past 20 years and I have been in the field of hair transplant for the past 10 years. In this video, I will be explaining you about the procedure of hair transplant, how we start the procedure and what are the various steps of the procedure, and I will show you all the steps differently. Now the first step which I am going to show you right now is after taking the blood pressure of the patient and getting the blood sugar test and getting the COVID test done of the patient. Now these all things parameters are normal. We are starting the process by giving local anesthesia onto the area from where we are going to make the spaces or slits and from where we are going to implant the graft. So you can see I am starting like this is a local anesthetic I am giving onto full area, and initially it is slightly painful for a couple of minutes, but the effect of local anesthesia comes very fast. So within 2 to 3 minutes the whole area becomes numb. So you can see I am giving injections with the insulin syringe, which is a very fine syringe which produces very little pain on to all the areas which are to be numbed. And similarly same sort of procedure we will follow for the back also, which is the donor area from where we will be harvesting the grafts. So you can see that I am asking the patient also. Now he is not feeling too much of a pain. So say in around 2 to 3 minutes the whole area has become numb, and after that throughout the surgery patient will not be feeling any pain. Now since you can see we are doing this surgery in FUE technology, so the next step now what you can see is we will be making the spaces. The spaces are made with needles, and in the front we made the spaces with a very fine needle, so that we try to put single follicle grafts on the frontal hairline, which gives the most natural results and most naturally looking frontal hairline. So in this case you can see there we are making the slits and we are trying to make them as close as possible, and because this patient requires around 3500 to 4000 grafts, so on the full area which we have already do, and on this area we will be making around 3500 to 4500 splits. So you can see there is a oozing every time we make a split, but this oozing stops. You just press it a little bit with the pressure, the oozing stops. So this is the process of making this slits, which is the second process in the hair transplant surgery. Now third process, now you can see we have given local anesthesia to the area from where the grafts are to be harvested, which is the back of the head and the sides of the head. So if we intend to extract 3500 to 4000 grafts, we have to take some grafts from the side of the head. If the grafts are less, we generally take them from the back of the head also. We don't take it from the side of the head. So you can see we have already numbed this area, and now with a punch which is connected with a motor, and this punch has a vacuum also, we are harvesting single grafts from the back of the head. And we are not harvesting the grafts from one area, we are taking it from a very diffuse area, and after leaving 2 to 3 to 4 grafts we are taking out one graft, so that the density on the back of the head does not suffer too much. This process of harvesting the grafts, like around 3500 grafts, it takes around 2.5 to 3 hours, and then these grafts are stored in normal saline, and then we'll come to the final step, which is the implantation process. Now in implantation process, the grafts are which are stored in normal saline, and the splits have been made previously, and we apply a marking dye on the top of the head, which makes it more visible. And now you can see single grafts are being implanted on these slits which have been made, and you'll be able to notice also that some grafts have 2 follicles and some grafts have 3 follicles, like you can see 2 hairs or 3 hairs coming out of it. So on an average it is around 2.5 follicles per graft. So in someone, say around, if we are implanting 4000 grafts, so on an average we are implanting around 10,000 follicles in that person. So this is the final step when all the grafts have been implanted and each and every slit has been covered with a graft, and after that we apply a fixer on that area, and we do not do any dressing on the implanted area. A dressing is applied only on the donor area, which is generally on the back of the head. In some cases where we require more grafts and the donor area is not very good, we extract some grafts from beard also, which is a second option for a donor area. And the third option, if we still require more number of grafts, you can harvest the grafts from the chest also. But generally in most of the cases we try to harvest the grafts from the head only, because those are the most sustainable grafts. Like the information provided and the content of my talk, please like and subscribe the video, and in that case you will be getting further updates about new techniques and all the information about hair transplant as well. Thank you.